Thanks very much. I'm pleased to be joined by Dr. Jennifer Hayman and Kelley Bowden, who is a nurse practitioner here at the Barbara Bush Children's Hospital. Thank you both so much. We're talking today about infant safe sleep patterns. I know you're both experts in the field. Dr. Hayman, tell us a little bit about the do's and don'ts about putting your infant in for a nap.
Sure. Well, here we have an example of what would be considered a safe sleep environment. And if you notice, it's a very sterile looking environment. And that's exactly how we want it. There's no stuffed animals in the crib. There are no bumpers under which the baby could get trapped. There's one sheet on the mattress which is tightly fitted. Notice that the child is on her back, and normally you would have a child in clothing, and you would want the child in one thin layer of clothes, similar to how you would dress for sleep, on his or her back in order to sleep. And you want to make sure that the rails of your crib are not too wide. And typically we say if you can fit a can of Coke through the rail slats, that's too wide. Most cribs that are built today conform to safety standards, so you should not have an issue with that. But this is an example of a child sleeping safely.
Kelley, let me ask you a question. If you're bringing your newborn home in the middle of winter, obviously blankets are going to be an issue. What are some of the do's and don'ts there?
Sure. We want to make sure the baby stays warm. And to do that, just put an extra onesie on the baby, so a t-shirt or the little onesie that goes over their diaper, and then their sleep outfit. They make sleep sacks now, which are like a bag with a zipper, and that is enough to keep your baby warm during sleep. They really don't need a blanket or pillows, and in fact, those can be dangerous items to have in the crib.
So less is better.
Correct, yes.
And what are some other things that parents should stay away from?
Sure. Well, let me focus on the positives, and those are that we want to make sure the baby sleeps in the same room as the parents. And that is comforting to the parents, that they can hear the baby, and if the baby starts to cry and needs to eat, they can respond quickly. We don't want babies in the bed with the parents. That is a dangerous thing. Babies can suffocate, and we want to avoid that. We want to make sure that moms get good prenatal care. If they have a healthy pregnancy, they're more likely to have a healthy baby. We want to make sure that the babies get their immunizations, that they're not getting colds and flus that might put them at higher risk of SIDS.
And if folks at home are writing all this stuff down and they need more information, where can they go?
Sure. It's the American Academy of Pediatrics website, healthychildren.org.
Beautiful. Great advice. Thank you so much.
Thank you.